All right, everyone, welcome to the research work group. This is for Annie, and this is our monthly meeting. Believe it or not, this is our last official research work group meeting of the year. I feel like we're getting out a little easy, but we're encouraging everybody to attend the anniversary in October. So we won't be meeting then. I had the great pleasure of introducing one of my colleagues, Alex Hodges. She's going to speak to us today. And just to remind you that myself and Lisa Thompson, she's on the call as well. We are the co-chairs for the research work group. And we had an opportunity to invite Alex today, and her talk, includes research, it includes practice, it includes community. And of course, includes climate change. So we're excited to have a vast-reaching topic. So, like I said, Alex Hodges and I work together at ECU, Go Pirates, and she's going to talk today about climate readiness and preparation. Once the presentation is completed, you'll get a link a little bit later about your nursing CEs that you'll complete. There'll be a test that goes along with it. So she'll present, and then we'll have a little bit of time at the end for questioning. So take it away, Dr. Hodges.
Awesome. Thank you, Liz, so much. Well, again, I'm Alex Hodges from ECU. Climate readiness. Preparation is key. A few disclaimers to begin with. I am a volunteer nurse practitioner at the Community Care Clinic of Dare, and I had the pleasure of collaborating with AmeriCares and Harvard T.H. Chan School of Public Health. I don't have any disclosures. So today's talk, we're going to look at identifying potential climate change impacts, which you guys are so well aware of, on your patients and their chronic disease processes and conditions. But you may not know what appropriate resources you can utilize for that anticipatory planning of climate-related events. And you're going to describe educational resources for patients, staff, and your organizations. So why is this an interest to me? Well, it's pretty ironic. I would love to have shared a picture for today, but I didn't have time to get it into the presentation off of Facebook from last night. I do live on Hatteras Island. Currently, we lost a dune line last night and had ocean overwash, and literally you can see the headlights going right into the ocean. Very difficult to see where the road is and where the ocean is. So that's kind of a little bit about where I live. And why is that important? Well, I've been here since '93, Eastern North Carolina, all my life. And so hurricanes are a big part, but on Hatteras Island, it's even a little bit more unique. I can't even tell you how many hurricanes we've been through. Putting your kindergartner and your second grader on a headboat, a fishing boat, to go to school is a unique experience. We crossed the inlet during that, the inlet that was made just a bit down the road from my house. We would get in our skiff to go to our car to go get groceries, or my husband would get in the skiff to go to his second clinic to see patients. So totally a different experience. Flooding, again, too numerous to count. One of the most memorable would have been Hurricane Matthew, and numerous people lost so many things because it wasn't predicted to be a bad storm, kind of like one very recently. Lost our vehicles. I lost my job because I couldn't get to my clinic, and that was just kind of the end all be all. So it impacts in many, many ways. And then I actually have experienced a house fire. We were out of our house for 6 months. So certainly have an interest in climate and how that impacts care. Where it really came to the forefront was when I had the opportunity in my clinic to work with AmeriCares and Harvard and creating this amazing toolkit that we're going to share in just a few minutes. So this is just a little bit about where I live. In the upper left-hand corner, this was during Hurricane Matthew in 2016. That's the school. That's the 6th grade through 12th grade school. So you can see first building there is the cafeteria. So you can just imagine the health impacts that are long-term because of the water that's gotten into the walls. The bottom left, that was when I was driving home from the clinic that day when it was not supposed to be too bad. The middle picture is the house next door to me. that actually was essentially destroyed in Matthew and was subsequently torn down. But the really cool thing is then the next day is a new day. And usually it's a glorious day. So it's a pretty unique place to live. Again, you guys are the experts in the room about climate change, but I just want to draw your attention, thinking back to 2022, these are the billion-dollar weather and climate disasters in the United States. You may, be looking for your locale. If you're in California, you had the heat wave and the drought. If you were up north, you saw the extreme weather with snow, hurricanes down in Florida with Nicole, Ian, and Fiona. But looking at where I live, North Carolina, there isn't anything big that happened according to the billion-dollar climate chart. Why is that important? Well, in North Carolina in 2022, there was almost 7,000 wildfires covering over 20,000 acres. There were 17 tropical storms, 14 of which were named, but there were no direct hits. So you'd think that's no big deal, right? No, nothing to worry about. But is it? This is a house on the island where I live in May of 2022, just a nor'easter hit, no way to predict it, and it's falling in the ocean. While it's not a billion-dollar impact, it's just as costly to anybody that's impacted by severe weather. Their homes lost, property lost, job security, loss of personal effects. If you've ever cleaned up after a hurricane and you're picking up your memorabilia, your family photos, it is an absolutely devastating, traumatic experience, and unfortunately, loss of life. So let's fast forward to this year. Where are we already? Well, wow. Maui saw the forest fires, over 3,500 acres, and a death toll of 115. And again, that was as of 9/7. There may be more. Numerous missing, over 100. Hurricane Idalia could reach $20 billion and 3 deaths. Burning Man, which is supposed to be a glorious event. Many people go, have a fantastic time. There were more than 70,000 people stranded in a muddy, hot mess. So just last week, Tropical Storm Ophelia made landfall in Wilmington, winds at 70 miles an hour. No big deal, right? Very big deal. Plus 3 feet mean high water mark flooding. That's the highest since 2016 in Jamestown. There was a tornado. There was travel disruptions, roads, ferries canceled, multiple states, North Carolina, Virginia, power outages, homes that are just destroyed, boats that were off their moorings, piers that were displaced. So the costs have yet to be displaced. So what does that mean, and how can we think about, so we know what happens, why is it happening? Well, the changes, of course, in the climate, as you guys know, again, you're the experts in the room, the global temperatures, the extreme weather, disasters, it's all on the rise. And these effects, the extreme heat, the water pollution, reduced food and water quality, changes in infectious diseases and vector transmissions, increasing allergens. In Dare County, we've had 3 Vibrio deaths this summer. That's a pretty significant statistic, and looking nationwide, it's even more. Why is that happening? Because the water is hotter than it's ever been. So those health impacts, heat-related illness, cardiovascular disease, stroke, chronic conditions, injuries, death, mental health, from the traumatic experience even to as far as air pollution, we're seeing numerous things that are going along with that. Always we think of respiratory diseases when we think of climate change and flooding and hurricanes, but it also can be your kidney disease, your diabetes. So what are the interventions that we can do? So early warning and preparedness, prevention and reducing that chronic disease and injury, engaging your community, educating, raising awareness, and adopting and integrating those plans. So this happens to be myself at the community care clinic with one of our patients talking about one of the sheets that we have available in this amazing toolkit. And I'm going to share the links at the end so that we're not kind of jumping all around and everything. So how did these toolkits come to be? Well, we did some research and we found that 81% of our clinic staff said their clinic experienced some kind of disruption due to extreme weather within the past 3 years. So these clinics are primarily our community care clinics or free clinics for our underserved population. That's a staggering statistic to have 81% say that it's happened to them. Fewer than 20% of that staff felt they were very resilient in the face of extreme weather, meaning how do they respond and how do they recover? And then 77% of the staff said they don't have the knowledge or tools to implement climate change preparedness at their clinic. And more than 80% wanted more education to train and protect their patients from climate-related events. So then what we did, the next step was we created pilot studies where providers, administrators, nursing staff, everybody that makes those clinics run. And at my clinic, that includes a pharmacist and a dentist, so a fully integrative clinic. And we created a toolkit of what was important. How do we address these needs of the patients? But also, how do we address the needs of the clinic? How do we address the needs as far as administrative staff goes? And how do we educate our providers to understand what happens when Miss Sally is a diabetic and there's a hurricane bearing down? What is the education that they need to have from all those levels? And so we created a toolkit. There are modules on extreme heat, wildfires, hurricanes, and flooding. They now are in Spanish as well as English, which is a huge impact to our patient population. Being at the need of where the patients are and meeting them is paramount. So as I said, there's clinical, so the providers, educational pamphlets for the patients that you can actually print and hand out and talk about when you're seeing the patients, and operational. So looking at the administrative portion of how do you prepare for a hurricane? How do you prepare for flooding? Do you have a generator? Do you have provisions? Things that administrators never really have thought about. And then again, making that clinic prepared. I want to really focus on the what each part does. So resources for the patients, they're disease-specific tip sheets. There are tip sheets for diabetes, kidney disease, respiratory disease, or just chronic illness, hypertension, looking at dehydration during extreme heat waves. Then there's hazard-based disease management action plans. So thinking about how do I prepare if there's a power outage? What happens if the air quality is poor? Do we need to evacuate? What is the plan to evacuate? And then guidance even on accessing those heat forecasts and air quality conditions and more. Most patients, even those that are in my clinic that qualify for the community care clinic, so meaning a strict income of the household, they can't have insurance, etc., they all pretty much have a smartphone. And so downloading that app is paramount. And one of the things that I really have strived for with my patients is we talk about hurricanes in the winter. We talk about heat in the winter. We're talking about flooding pretty much any time, because unfortunately in Dare County, that's something that can happen anytime. But we have that conversation ahead of the event. And we kind of drill it home. We give them the handout. And then when they come back in for a follow-up, we have a checklist. Say, hey, have you thought about, you have diabetes and you have insulin. What is your plan if the power is out? So I mentioned that we have these resources for the clinicians as well on all these toolkits, and how it gives an overview of how those events impact health. There's specific content, again, for heart disease, diabetes, COPD, renal impairment, etc. Looking at how do you educate your patient to hydrate when they have renal disease? How do you make sure you've got them on the right medication? Even having the discussion of what kind of work do they do? So if they are a commercial fisherman or a farmer or construction worker outside and you're seeing them for MRSA, you don't want to put them on Bactrim because they are going to burn like there's no other. But those are important factors to take into account, and not everybody really thinks about that. Creating disease action plans with patients for those hazards. So we all know about asthma action plans that don't happen as often as they should. But having these action plans in this toolkit that you can give a checklist that they can then have on their refrigerator, and they go, oh, tropical storm Ophelia is coming and we're evacuating. What do I need to do? I just need to go get my checklist, and I know everything I need to pack and everything I need to take with me. How do they assess the air quality and temperature forecasts? Again, going back to what are their resources? If they don't have a phone, do they have a television, local news, media at bursts, etc., or even signing up for the extreme weather alerts? My phone went off nonstop last week. Had to laugh as it would go off at 4:30 in the morning to tell me that we were under a coastal flood warning that wasn't going to impact me until the next day. But great tools. So again, having those alerts, talking about those administrators, how is the facility prepared? Looking at those checklists. What do they do for power outages? How do they notify their patients? Is there an audio message? Is there text? Is it social media post? Just what is it? So I'm not one that likes to talk all the time. Of course, I know that some on here are saying I probably do. I want us to have a little bit of a case discussion and talk about what do you do for flooding, just using that as an example. So this is Tropical Storm Ophelia that I mentioned that hit North Carolina last week. And this is the Pamlico River Drive in Beaufort County. And you can see the gentleman standing there with relation to the stop sign. That's a lot of flooding. So what we're going to talk about now is AmeriCares. I'm going to give you an introduction slide so that you can see, and then my good friend Jan's actually going to play a little video here to talk about the climate resilient clinics, and then we're going to dive into the toolkit and see exactly how it works and what you can find. Stop sharing and change screens.
Am I up, Alex?
Not
yet.
Sure, go ahead. That makes sense. We're pivoting.
Can you see it?
Yes.
Let me know if you can hear it.
Climate change is not an equal opportunity health problem. When climate shocks arrive in the form of more intense heat waves and wildfires, more devastating hurricanes and floods, the communities most at risk are the ones that have the weakest infrastructure to combat them, and those are often, if not always, in the lowest wealth communities.
We work with healthcare providers at free clinics and community health centers all across the country. They are seeing the health impacts of climate change affecting their patients, but really aren't getting the resources that they need. So many frontline clinics are in high-risk areas for extreme weather, and they serve patients who are often from low-income and marginalized communities who are impacted by climate impacts like heat waves and flooding and hurricanes, and yet often lack the resources to recover and rebuild.
The Climate Resilience for Frontline Clinics Toolkit includes a suite of resources that are focused on specific populations like providers and staff at clinics, as well as patients, and also specific hazards from climate change like wildfires and heat waves and floods. We have resources for people with asthma and COPD, as well as heart disease or multiple sclerosis.
The content is available for free on the AmeriCares website, and trainings are being offered to health centers across the United States. Clinic staff can download the relevant handouts, print and share with patients.
It's really about what we call patient-centered climate resilience, the idea of thinking about the individual first and what we need to do to protect the individual, and then working backwards to say, how can the health system make that possible?
We've seen how resources and attention are really focused on hospitals and bigger health systems, and there hasn't been enough capacity building and resources provided to these frontline clinics that are really on the front line serving their communities.
I think the climate resilience toolkit for frontline clinics is so valuable because it meets the needs not only of patients, providers, administrators, and helps us prepare for things that are impacting us on a daily basis. This educational packet and these patient materials has been a pivotal moment, not only for this clinic, but it'll be a pivotal moment for others throughout the nation, and my hope is around the globe. Thank you. So that was one of the, as you can tell, promotional videos that really talks about why this toolkit's important and, what do you do with it? Well, the toolkit is available for anyone to use. You can download it for free. It is not proprietary. You can download it, print it, etc. And this is one of the links, and we will, Liz, I'm assuming we'll share those as well so that you can find it. But you can literally Google AmeriCare's toolkit, and the toolkit really helps prepare, again, frontline clinics. And when we think of frontline clinics, I think Dr. Bernstein was amazing in saying that, these clinics are so limited in resources, but this can be applied to any clinic. It doesn't matter if it's an underserved clinic or if it's my husband's clinic down the road, using the same information, can print it and can share it. You can access the toolkit in numerous ways. Here is one at the bottom of this screen. But again, the risk of climate crisis, looking at the projections for climate change, an additional 250,000 deaths a year from 2030 to 2050. We've got to do better. And so how do we do better? Well, we can start being prepared, as well as many other things. So here you can sign up for the toolkits, or you simply can just click, and we're going to go to the floods. Floods, again, we know exactly what it can do and thinking about things, but let's start with the providers. So thinking of, and when I say providers, I don't just mean the nurse practitioners and physicians, I mean our nurses. Nurses are paramount to providing care. This can be anybody that's providing care, but thinking about what is important. So looking at what is important, giving this education to someone that this is not their area of expertise, which is probably 95% of the population. Unfortunately, I just don't think we're really cognizant of how bad it can be. Looking at this annual loss due to floods by the county in 2020, there is a lot of darkened orange spots on this particular sheet. So the health impacts of floods, looking at immediate risks, so drowning, electrocution, cuts, falls, head injuries. It is just magnified because of the risk that can happen. And then you have the infectious disease that follows the flooding, which we of course understand: cellulitis, skin infections, tick-borne illnesses, hepatitis, and toxic exposures, mental health. There is an increase in depression related to this, anxiety, post-traumatic stress. Then we have the disruption in our infrastructure and displacement. So you can see it really hits everything that you can think of. Thinking of our older adults, they're going to have more comorbidities. They're going to have limited capacity to evacuate. What is your plan for evacuation? Do you live in an area that has mass transportation? Or is it going to be that emergency management is going to do what we do in Dare County, and that is utilize our public school buses to bus folks wherever? And unfortunately, sometimes there's not a great place to go because it hits Eastern North Carolina all the way inland. So looking at those forecasts, using reduction of heat risk from floods, as I said, evacuation. And then if you look here, of course, that again, it is important that it is dual language, English and Spanish. But here's a flood plan. So this is what I was talking a little bit about earlier. as far as plans for disease processes that have it for each one of those as well. So this is, what are you going to do? How are you going to evacuate? What are you going to take with you? Writing down your notes, etc., so that you are following through. Then how do you help your patients? Because you've done all that. You know what you need to do. How do they know what to do? So what's the risk for flooding? Using, like I said, the phone app, signing up for your county alerts, looking at weather.com. Know where you live. What is your risk of flooding? What is your sea elevation? What has it flooded before? Doesn't mean it's not going to flood. How are you going to get your medicines if the road's closed? How are you going to get to your appointments? Things like that. Also understanding that when we have flooding or strong winds, what are the consequences? Carbon monoxide poisoning, electrocution, infections. Talking to your patients ahead of time. Looking at mold. Talking about power outages. And then we can then go disease specific. And that's why when I use the toolkit, I kind of start broad, like I do hurricane preparedness, and then I talk about their hypertension. Or in the summertime when it is so hot, I'm usually talking about hypertension, dehydration, kidney disease, using those toolkits, and then handing the hurricane as a, hey, we're getting ready to go in hurricane season. Let's start thinking about, how do you prepare? Again, your flood action plan. I want to show you the immediate action and then reentry, because that's not something a lot of folks think about if they're not prone to being evacuated, those kind of things. So as I said, it's a checklist. Very easy to have. Do you sandbag? Do you normally get flood water in? Do you need to prepare the windows? What do you need to do in the event of this potential storm? How do you repair and re-enter? So it actually gives you a checklist to look at, down to even the furniture being broken, or is it mold? Is it contaminated? How do you clean it? Do you have potable water? Is your sewage system functioning? Because out here, we're not on a city. It's all, everybody has their own septic. So, how do you test those things, and what do you need to do? And how do you get back in to certify for occupancy? Do you need to reach out to the county? Are you going to be able to open up without being checked off? Vividly remember after Hurricane Emily, when I first moved here, in the medical center, we stayed in the medical center, and I will never forget, my dog was with us, a little Cocker Spaniel, and she was running up and down the hallway, and she came back wet. And I was like, what's that? Well, it wasn't just flood water, it was septic. And ironically, the county couldn't get to us to determine if we could see patients or not. We had to see patients. The Red Cross came in. It was a whole new welcome to Hatteras Island. I had been here a month. And so these toolkits are extremely important, and have a place in my heart now that I understand the importance of them and why we need to do what we do. So it is a unique, as I said, experience to understand kind of thinking about, what do we do? How do we get there? What is important? What impacts you? What impacts your patients? What impacts your workplace? Are you ready? Are you resilient? And if you are, that's fantastic. But what changes will you make? Because even though you might be resilient, are your patients going to be resilient? Is your workplace going to be resilient? There are changes that every one of us can make to be just a little bit more prepared. And I'd like to open it up for questions.
Thank you so much, Alex. First off, I didn't know this was even out there. All these free resources. That's amazing. I guess my first question is, what's your favorite part or resource that you provide, or like what attracted you the most, I guess, to this group's information?
Well, probably because I got to help develop it, helped a little bit, but truly one of the best resources that they have, and I'm going to pull it up so I can share it, is the heat resource, because the flooding to me was one that we could talk about pretty quickly, or I could show you quickly. You're going to see why I did not choose heat. We wouldn't, it could be an all-day event. So there's chronic kidney disease, asthma, cardiovascular disease, dementia, diabetes, mental health disorders, MS. The list goes on. And heat is something that impacts everyone in every one of those scenarios, whether it's a wildfire, a flooding event, or hurricane. Yes, flooding can happen in the wintertime, so heat's not going to be the issue, but it is primarily one of the biggest things that we see. And the fact that, I have a heat tip sheet that I can hand my patients that have, a certain disease or illness, and I'm not seeing the one that I wanted, but even for pregnancy, asthma, the cardiovascular disease. So the cardiovascular disease one to me is phenomenal, because again, it reiterates, each one of them does, how do you get your information? How do you know what's going on? And we know that adults have to hear things about 7 times before they understand it. So especially for a patient, that's just something they're not gonna take into account. But it actually goes into, what color is their urine? Are they hydrated enough? So this is probably my absolute favorite toolkit, is the heat. I utilize the general statement one, the cardiovascular disease one, because it usually hits everybody. And then even I use the action plan one, because it really it hits kind of everything. Great question.
Hi, can you hear me?
Yes.
Okay, I had a question. How do you broach the topic with patients who may or may not feel that climate change is a real problem?
Mm-hmm.
That we just say this is a weather event and you need to prepare for this weather event.
Yeah. So I oftentimes actually take climate change verbiage out initially. Once we start talking about, this summer or spring was a great example, was really preparing for the heat and hurricanes. And I'll never forget, it's actually one of it was the day that the news crew was at my office. And I had seen him 2 weeks prior, and I'd already done that introduction. And so he came back and he said, Alex, I just never really thought about it being climate change, that we're having all these hurricanes and that we've got waters where we've never had it. And it prompted a discussion of, I talked to the folks on Hatteras Island, I call them the old timers. They're some of my very favorite patients, and they'll say, honey, we've never had water there. You don't have anything to worry about. And then Hurricane Matthew hit.
Yeah.
So I usually broach the subject of, let's talk about, what is your plan? You're working construction, you're a commercial fisherman. How do you manage the heat? How are you hydrating? My son is a volunteer firefighter and working construction this summer, and he was so tired of me preaching it. Every day he'd come in, I'm like, are you hydrating? So I think approaching it from a standpoint of the general, and then bringing it around to climate change. And then, so that particular patient, he said, I do have a generator, and now maybe I do understand the need to recycle and reuse, and maybe I can have a positive impact. So it does come full circle.
Yeah, I know. I was just in New Orleans, and they're having, because the Mississippi is so low, they're having saltwater intrusion coming up from the Gulf it's moving slowly up. They say by October, there'll be no fresh water because the salt water is intruding into the drinking water system. So they're bringing in millions and millions of gallons of water from up the river to dump it into the cisterns. So that, these are things that I think you can't even fathom, or even, sort of opening up, there's no water to solve that problem.
Yeah.
So, I think when I was there, they were showing a lot of information about this problem, but they just said there's a drought and the Mississippi is low, and we can't even they can't even carry the cargo down the Mississippi on the boats at full they have to carry them half full because they'll scrape the bottom of the river. And it's just like,
Wow.
These regional things that happen and people address them regionally, but they don't kind of put the whole thing together, that it actually is not, and I was talking to my aunt who's from South Carolina Islands, and she's like, well, hurricanes always happen. We've lived through them all of our lives. And, it's more the frequency and the intensity that people are, that you have to focus on, I think. So thank you very much for presenting. This is really thought-provoking, and I enjoyed it.
Awesome. Thank you. So
I have
to
a
kind of,
question,
okay.
for you real quick.
Sure.
I think you said there was an app for this, correct?
So there's not an app for the toolkit.
Okay.
The apps was meaning the weather app. So downloading whatever weather app is applicable, but also then signing up for weather alerts. So OBX Alerts has an alert system. So knowing what's located in your area. But this is a web-based product, so you can access it on your phone. You can access it on the computer in the clinics. It really is, and then print them off. There's hundreds of things.
Looks like it. So whoever's sharing their screen, can they stop sharing? I'm seeing several pictures of myself. It drives me crazy when that happens. I don't know who's sharing, but thank you. I've done that a lot, so it just is hard to concentrate when you're seeing yourself in 3 different places. Okay, so you can download it. Just as you're talking, I'm thinking about how this can be used in research. And one area, this is sort of tangential, but I think might work, because a lot of times we have control groups that aren't getting the intervention, but we want them to get something to stay engaged. And these could certainly be things that are downloaded. A lot of times I send out healthy homes type of things, but certainly could use this as information to be sending about basic information about heat, floods. I'm in Kansas, so hurricanes don't really hit here. Although when I lived in Ohio, we did have a hurricane.
Oh, wow. Yeah.
It came up from the Gulf. So I think that would be, there is certainly there. I think you could also use it just as a community engaged type of education. I don't know. Any other thoughts on that? How it can be used for research? Lisa, whoever else is on.
I think it's a great idea. In fact, I think I'll look at them after. Would you mind putting in the link? I went on AmeriCares and I had a hard time finding it, and I know you were showing your screen, but maybe if there's a
Sure,
link,
I'll put it in the chat box. Yeah.
But yeah, I think especially I saw that you had them in Spanish, and I work in Guatemala on air pollution, and we're actually our attention control group is receiving little saplings that we're planting. And so we're planting thousands of trees in this part of, and just because they wanted something, the control group doesn't want to just sit there. And so I was thinking some of these Spanish language ones on heat and are definitely applicable to them, and because they're small land owning farmers.
Yeah, absolutely. And we are already taking it to the next step. Many clinics are doing, so we've had the they didn't have any education, and now we're having the post. What things have improved? Have we utilized preparing for power outages? Are we providing dry ice? Thinking of the clinics, my clinic, where patients don't have money or don't have a car to go get a bag of ice. So having dry ice when there's an event coming up, having some of those things. So they're already looking at, what sort of impact we've had. And then taking it to the next step of, okay, so we have this, what else is missing? What else is happening? One of the things is aquatic infections. that we really need to focus on. And so we're working on some toolkits for that. And so looking at what is the data showing of where are the illnesses, what can we change? So it is definitely evolving.
An interesting thing, Alex, that I don't know that everybody thinks about. I certainly didn't until I moved to a coastal town, a really small town. I've been looking for the last 2 weeks for flu shots and COVID vax because I wanted to get them at the same time. And at our university, we have to have them by October 1st. So I'm like down to the wire, and I'm shopping in Harris Teeter today, and my husband says they have the vaccine. And so I got my flu shot and COVID vax at Harris Teeter. And the thing I didn't know is that most of the primary care providers in my neck of the woods don't carry vaccines, because when the power goes out, it's too costly for them to lose them. And they did that for many years, right? And it's a big, hairy deal to get that stuff going. And so even just that kind of thing is a different process in our communities than inland in the medical center, just an hour and 30 minutes from here, where you can get vaccines in many places. So it's just different.
Absolutely. Absolutely. And then you have the state regulations on vaccines of the temperature monitoring that has to be electronic so that they know that the freezer temperature did not change. Whereas when I moved to Hatteras Island in 1993, our method for making sure that the vaccines were stable, and my husband's in the other room, he's going to laugh that I'm sharing this, but we froze a cup of water and put a penny on top. And if the penny sink was down, we knew that we had had a compromise of the freezer. Worked really well. But it's not sufficient for the state now. So there is a lot of impacts. Absolutely.
This is completely off the topic of, I was going to say this is.
Barb, I just want to say one thing. I think
Yeah,
our meeting might automatically end in 2 minutes. So if it does go away, I just wanted to say thank you. But Barb, go ahead.
I have nothing to do with climate change, but the pharmacists in our area and CVS are all walking out, so we can't even get where we usually do. So it's a completely different issue, but anyway.
So
That's
Barbara,
insane.
come to vacation in coastal North Carolina and go to the grocery, and you can get your vaccine.
Kind of crazy. But it was a really great presentation, Alexis, and really great information.
Thank you.
I appreciate that.
Yeah.